If you witness somebody having a stroke or you're having stroke symptoms, there's not a lot you can do. We actually don't recommend you take an aspirin because you don't know if it's a bleeding stroke or a blood clot stroke. Always call 911. It is the most expeditious way to get to the emergency room. An easy way to think about the symptoms of stroke is the mnemonic B FAST. It stands for B for balance, so sudden onset problems with balance or dizziness. E stands for eyes, so sudden onset double vision or loss of vision. F is for face, so if somebody is talking and they suddenly develop a facial droop. A is for arms. You can ask somebody to raise up their arms, and both arms should be able to be held up equally. If one arm drops or isn't able to be elevated, that's a sign of a stroke. S is for speech, so it can either be slurred speech, it could be gibberish, so production of language, or it could be difficulty comprehending speech, any of those symptoms. And then T is time, so again, getting to the hospital in time, because the earlier you get there, the better the outcomes are. The important thing with all of these symptoms is they're abrupt onset typically. So vision loss over months is not a stroke symptom, but vision loss suddenly would be a stroke symptom. While I said that stroke typically does not cause headache, there is a specific type of headache that should be concerning and alarming. There's a headache that is caused by a bleed inside the brain, a subarachnoid hemorrhage, which is bleeding around the brain. And that headache is a sudden onset, worst headache of your life. It's not a mild headache, it's not a tension headache, it's a sudden onset. The person is normal and then suddenly develops a severe headache. It's very important to take that very seriously and call 911. There's also sometimes a shorter version of that called a sentinel headache, where somebody will have a bleed, will have a headache for an hour or so, the headache goes away, you still need to come in. If it was a sudden, abrupt, severe headache, that needs to be addressed in the emergency room. Another condition we often overlook is TIA, which means transient ischemic attack. A TIA is essentially a blessing in disguise. It's the same thing as a stroke. A blood clot travels to the brain, blocks a blood vessel, causes the symptoms of a stroke, but your body's internal mechanisms break up that blood clot, the blood clot goes away and the symptoms go away. So you are very lucky that it didn't cause any permanent damage. The importance of a TIA is it's an opportunity for us to be able to figure out what the cause of that was and potentially prevent a major stroke. After a TIA, there's about a 10.5% risk of a major stroke in the next 90 days. So it's extremely important to go to the emergency room if you do have TIA symptoms. They can last 5 minutes, 10 minutes, and then go away. Oftentimes people feel relieved, they feel like they dodged a bullet and they don't need to go in. They absolutely need to go in at that time. If you witness somebody having a stroke or you're having stroke symptoms, there's not a lot you can do. We actually don't recommend you take an aspirin because you don't know if it's a bleeding stroke or a blood clot stroke. We recommend that you lie down, probably on the side, and wait till EMS arrives, paramedics arrive. Again, always call 911. It is the most expeditious way to get to the emergency room. When they pick up the patient, they evaluate the patient in the field, and we know the patient's coming to the hospital before they even get there, so we're prepared for them. As opposed to trying to walk into an emergency room where there might be lines, there might be registration and delays in getting to the physician. We're extremely proud that Queen of the Valley is a comprehensive stroke center. And for those of you who don't know what that means, a comprehensive stroke center is essentially the highest level of certification that a center can have when it comes to stroke care. One of the huge highlights of having a comprehensive stroke center here in West Covina is that, number one, you have state-of-the-art care, cutting-edge medicine without having to leave your community. Everything is provided at our hospital here. And the importance of that is it avoids delays. You are immediately treated. You don't need to be transferred somewhere else where there may be delays. And so you get the absolute quickest and most appropriate care immediately. Secondly, being at this center, we have leading experts, physicians and nursing who take care of these patients. They're all specialized in all the different aspects of care, including the emergency department, the intensive care department, neurologist, radiologist, neurointerventionalist. You have a whole team that provides this care, again, not having to leave your community. Finally, after the patient goes through their initial experience in the emergency room and the acute treatment that they receive. We also have a very specialized care team, multidisciplinary team, that provides the rest of the care through their stroke journey, which includes their stay in the intensive care unit, their stay in the stroke unit, and even afterwards in the rehab unit and outpatient world. So at Queen of the Valley here, we truly provide a comprehensive continuum of stroke care for you.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate Health videos.